Welcome back to Daytime Ottawa here on Rogers TV. The pandemic has affected all of us, and it has certainly affected and impacted professional workers. And here to tell us about the results of a new study, I'm joined by Ivy Bourgeault. She is a professor at the University of Ottawa. Thank you so much for joining us, Ivy. And let's dive right into this. Tell me a little bit about the study. Maybe you can give us an overview of the study in general.
Absolutely. So we were really interested in the experiences of mental health and the decision to take a leave of absence and then return to work amongst professional workers. And we started doing this prior to the pandemic, and we were about to launch our survey when March came around. And so we kind of backtracked and we said, really need to take into consideration what impact the pandemic is having. So we were interested in that pathway. What were the factors and forces that influenced, one's decisions and also the experiences of mental health, and then how the pandemic had an impact on that and how it compared to prior to the pandemic.
So let's talk about that compared to prior to the pandemic, and we're still in the midst of it now. So what are some of the results that you found when it came to mental health and professional workers?
Absolutely. So we found that, that there's generally experience of mental health amongst professional workers. And it's interesting because, these are considered good jobs. These are the jobs that, you want your kids to go into, and you study and you work really hard to get into these jobs. But there are some unique stressors that those in professional roles experience. And the groups that we looked at were health workers, our health professionals, doctors and dentists, nurses and midwives, and then also professionals who work outside of healthcare, teachers, academics, and accountants. And so each of those professions have been uniquely impacted by the pandemic. And then we also wanted to take an explicit gender lens on this to kind of look at how one's gender identity has an impact on those experiences. And so we found that what is typical is that women are more likely to report experiencing mental health issues. But we found also that women in these professions were differentially impacted by the pandemic. And you can see that with teachers, the work that they were doing, nurses and midwives, disproportionately frontline workers, and impacted by all of the different stressors of the pandemic.
So when we look at these experiences of mental health, to take those decisions of the leave of absence and then returning to work, is there some mental health impacts to that kind of decision making?
Yeah, absolutely. What's interesting is the pathway to taking a leave of absence and then returning to work is much clearer if you have a physical health issue, right? If you've had an injury. And in fact, the forms that you have to fill in typically has to identify a particular incident. Now, if you're suffering from mental health issues, if you're, burnt out, if you're at work and it's just a role overload and work strain, then it's really hard to kind of say that there's a particular instance of what is happening. Across all of these professions, there was a really unhealthy level of stigma associated with mental health, which is ironic in the case of health professionals, right? I mean, these are the professionals that we go to for mental health, relief, and yet there's a high level of so that really prevented a lot of workers from taking a leave of absence. And workers who are, in private practice, such as doctors and dentists, it was very difficult, for them to take a leave because there's no pathway, there's no, coverage, so who's going to cover their patients and that sort of thing. And then the return to work, people would say to us, well, if I'm coming to the same toxic environment that I left in the first place, why would I bother? And so although we found people did return to work, more likely that was because of economic reasons rather than that there was a solution to the mental health cause of their leave of absence.
So, taking this information then, Ivy, what can we, so I think we can glean a lot from this information, but, are there plans on using this information? I mean, obviously you're doing it to raise awareness on shows like this, but other than that, is it going to be used as a resource?
Absolutely. So what we are using, and the reason why we collected this information is so that we have an evidence base so that we could create interventions that actually work, that actually meet the needs. And so really understanding what that pathway is for mental health, leaves of absence, return to work, where along that pathway can we intervene? And how might there be unique interventions that we have to design for the different types of workers, recognizing, their gender, so that we want to make these interventions gender sensitive. And so that's the phase that we are moving into next, is how could we create some interventions for the individual to take on, for people in supervisory or managerial roles, and also their organization, such as the university or a school or a hospital, etc. So that's the exciting phase that we're moving into now.
Yeah, and it's an incredibly important study to have at any given time, but most certainly during a pandemic as well. Ivy, thank you so much for joining us. Really appreciate it. Don't go anywhere. Coming up after the break, we're going to be talking about sleep and the importance of pediatric sleep. We'll be back after this.